Half of the people who agree to major surgery after the age of 60 believe they are making the safest possible decision. They trust the recommendation. They trust the white coat. They trust the system. And in that moment, everything feels certain. The diagnosis is clear. The solution is presented, and the next step seems obvious. Sign the paper, schedule the date, move forward. But here's the part that no one says out loud. Not every surgery that is recommended is the best decision for your body. Not at your age. Not in your condition. And sometimes, the real danger isn't the disease you're trying to fix. It's what your body has to go through just to survive the operation. I've stood in rooms where families were told the surgery was successful, while the patient lay there unable to speak, unable to recognize them, unable to return to the life they had just weeks before. So before you assume that surgery is the safest path, I want you to stop for a moment and ask yourself one uncomfortable question. What if the biggest risk isn't saying no to surgery, but saying yes without asking the right questions? My name is Dr. Kevin Attawale, and I've spent more than 2 decades inside operating rooms as a cardiothoracic surgeon. I've performed complex procedures on hearts that had only minutes left to function. I've seen surgeries that gave people years they wouldn't have otherwise had. But I've also seen something else, something that stays with you long after you leave the hospital. Patients who came in hoping for improvement and left with a completely different life than they expected. Not because the surgeon made a mistake, but because the body itself could not handle what the surgery demanded of it. And that's the truth most people never hear before they make their decision. We've built a system where surgery often feels like the final answer, the definitive solution, the thing that fixes the problem once and for all, and sometimes it is. But the human body doesn't operate in simple, predictable ways, especially as it ages. Think about it like this. If you take a brand new machine and push it to its limits, it will usually hold up. But if you take an older machine, one that has been running for decades, one with wear and tear you can't fully see, and you put it under the same stress, the outcome is far less certain. The parts don't respond the same way. The recovery isn't the same. The margin for error is much smaller. And yet, for a long time, medicine treated these two situations almost the same. A 40-year-old body and a 70-year-old body were often expected to go through the same process and come out the other side in similar condition. That assumption is slowly changing, but many patients are still being guided by outdated expectations. When an older body goes into surgery, everything becomes more complex. The heart has less reserve, meaning it has to work harder under stress. The lungs don't clear anesthesia as efficiently, which can prolong recovery. The kidneys process medications more slowly, increasing the risk of complications. And then there's the brain, the organ people rarely think about in this context. After major surgery, especially under general anesthesia, many older patients experience confusion, memory loss, or difficulty focusing. This isn't just a few hours of grogginess. In some cases, it can last weeks, or even months. Doctors call it post-operative cognitive dysfunction, but for patients and families, it feels like something much more personal. It feels like losing a part of yourself, even if only temporarily. Now, I want to be absolutely clear, because this is where people often misunderstand the message. Age alone is not the problem. I've operated on patients in their 80s who recovered faster than people decades younger. The real factor is something called frailty. Frailty is not about how old you are. It's about how much resilience your body still has. It's about whether your body can absorb stress and still function normally afterward. And here's the part that matters. A significant percentage of people over 75 fall into this category of reduced resilience, whether they realize it or not. Which brings us to the most important distinction in this entire conversation. There is a difference between surviving surgery and recovering from it. And too often, that difference is not fully explained. Let's talk about the first major category where this becomes critically important: open-heart surgery in older, frail patients. Procedures like coronary artery bypass grafting have saved countless lives. There's no question about that. But what many people don't fully understand is what happens during that operation. The heart is stopped. A machine takes over the function of both the heart and lungs. Blood is circulated artificially while the surgeon works. For a strong, relatively healthy patient, this is a controlled and manageable process. But for an older patient with underlying conditions, it becomes a full-body stress event. Every organ is affected simultaneously. The brain, the kidneys, the lungs, all of them are pushed to their limits. And while the surgery itself may go exactly as planned, the recovery can be unpredictable and, in some cases, overwhelming for the body to handle. What makes this even more important is that alternatives now exist in many situations. Less invasive procedures that can achieve similar outcomes without placing the same level of strain on the body. Techniques that don't require stopping the heart or opening the chest. But these options are not always the first thing patients hear about. And that's why one simple question can be so powerful. Is there a less invasive option available for me? Because sometimes that question leads to a completely different treatment plan. The second area where risk is often underestimated is spinal surgery for chronic back pain. Back pain is incredibly common as we age. It becomes part of daily life for many people. And when it becomes severe, surgery is often presented as the next step. But the evidence around complex spinal procedures in older adults is not as reassuring as many people think. Complication rates are high. Recovery can be long and difficult, and in many cases, the long-term relief is not significantly better than non-surgical treatments. Physical therapy, targeted injections, and lifestyle adjustments can often provide similar outcomes without the same level of risk. And yet, many patients are told that surgery is their only option. The truth is, it often isn't. Then there's cancer surgery, one of the most emotionally difficult decisions anyone can face. When someone hears the word cancer, the instinct is immediate. Remove it. Do whatever it takes. And that instinct is completely understandable. But the goal of treatment is not just to remove the disease. It's to improve the patient's life, both in length and in quality. In some older patients, especially those with multiple health conditions, aggressive surgery may not achieve that goal. The body may not be able to recover in a way that allows for meaningful quality of life afterward. And in those cases, alternative approaches, less aggressive but more manageable, may offer a better balance. Joint replacement surgery is another area where expectations and reality don't always align. For the right patient, it can be life-changing, restoring mobility, reducing pain, allowing people to return to activities they thought they had lost forever. But for patients with significant underlying health issues, the risks increase. Blood clots, infections, complications related to reduced mobility after surgery. These are not rare in higher-risk patients, and this is where preparation becomes critical. Strengthening the body before surgery, optimizing existing conditions, ensuring the patient is in the best possible state before undergoing the procedure. These steps can dramatically improve outcomes, yet they are often overlooked. Finally, we come to emergency abdominal surgery, a situation no one plans for, but one that many families face. When it happens, decisions must be made quickly, often under intense pressure, and the risks in older patients are extremely high. Not because of lack of skill, but because the body is already under stress. Multiple systems are affected at once, and the ability to recover becomes limited. The best way to reduce this risk is not during the emergency itself, but before it ever happens. By paying attention to symptoms early, seeking care before conditions worsen, and having clear conversations about preferences and expectations. So, what do you do with all of this information? You use it to take control of your decisions. Because the most important thing you need to understand is this. A surgical recommendation is not a final answer. It is the beginning of a conversation. You have the right to ask questions. You have the right to understand your options. You have the right to take the time you need to make the best decision for your body and your life. Before agreeing to any major surgery, there are a few questions that can change everything. What happens if I don't do this right now? Is there a less invasive alternative? What will recovery realistically look like for someone like me? And what are the actual risks based on my specific condition? These are not difficult questions, but they are powerful ones, because they shift you from being a passive participant to an active decision maker. After all these years, after all the surgeries, all the successes, and all the complications, there is one thing I believe more strongly than anything else. The goal of medicine is not just to extend life, it is to protect the quality of that life. Every decision should be measured against that standard, not just survival, but how you live afterward. Because in the end, the best outcome is not always the most aggressive treatment. Sometimes, it's the one that allows you to keep living your life on your terms.